Welcome back to our medical knowledge series. Today we're tackling a fascinating neurological mystery, Guillain Barre Syndrome, often pronounced as Guillain Barre Syndrome. This is a rare autoimmune disorder that affects our peripheral nervous system. Now, what does that mean? It means that our own defense system, the immune system, mistakenly attacks our body's own nerves. Quite often, this is triggered by infections, turning our body's defense mechanism into a double-edged sword. But how does Guillain-Barré syndrome really work on our nerve cells? Let's find out. Guillain-Barré syndrome primarily involves an abnormal immune response. In this condition, the body's immune system, which usually protects us from harmful invaders, turns against our own cells. Specifically, it mistakenly targets the myelin sheath, the protective layer that insulates and aids in the transmission of nerve impulses, or the nerve cells themselves in the peripheral nervous system. This misguided attack disrupts the normal communication between nerves and muscles. This mistaken attack leads to a myriad of symptoms. Symptoms of Guillain-Barré syndrome are diverse and sometimes alarming. The onset usually begins with a sense of weakness, often in the limbs. This weakness can progress to a loss of reflexes and can cause significant changes in sensory perception. Some patients may experience pain, often described as a deep aching or cramping sensation. In severe cases, Guillain-Barré syndrome can lead to paralysis, a frightening prospect that underscores the seriousness of this condition. Diagnosing GBS requires a combination of clinical evaluation and other tests. Diagnosing Guillain-Barré syndrome involves a combination of clinical evaluation, cerebrospinal fluid analysis, nerve conduction studies, and imaging. Once diagnosed, the focus shifts to treatment. The goal: to halt the progression of the disorder and manage symptoms. Early intervention is pivotal in the management of Guillain-Barré syndrome. Treatment often involves intravenous immunoglobulin, or IVIG, which is a blood product rich in antibodies. Another option is plasma exchange, a procedure that essentially cleanses the blood of the antibodies causing the disorder. But treatment doesn't stop there. Supportive care plays a significant role in recovery. This may involve physical therapy to help patients regain muscle strength and cope with the muscle weakness caused by the disorder. The road to recovery may be long, but remember, each step forward, no matter how small, is progress. The prognosis for GBS varies, but with prompt and effective treatment, most patients recover gradually over weeks to months. It's a journey, but one that many have successfully navigated. What is the primary pathological mechanism underlying Guillain-Barré syndrome? Is it A, excessive production of acetylcholine, B, autoimmune attack on peripheral nerve myelin or nerve cells, C, overactivation of the central nervous system, or D, genetic mutation in motor neurons? The correct answer is B. Guillain-Barré syndrome involves an autoimmune response where the immune system mistakenly attacks the myelin sheath or nerve cells in the peripheral nervous system. This leads to inflammation and nerve damage, causing the characteristic symptoms. Understanding the underlying mechanism of GBS helps us grasp why its symptoms occur and how treatments work. That's a wrap on Guillain-Barré syndrome. We've taken a deep dive into this complex neurological condition, exploring its autoimmune roots and how it impacts our peripheral nervous system. We've delved into the diverse array of symptoms, from muscle weakness and sensory changes to more severe cases of paralysis. The importance of early diagnosis and treatment has been underscored, highlighting the role of clinical evaluation, cerebrospinal fluid analysis, nerve conduction studies, and imaging. We touched upon the key treatment strategies, including intravenous immunoglobulin and plasma exchange, along with supportive care like physical therapy. The prognosis of GBS varies greatly, but with prompt intervention, many patients recover gradually, albeit some may experience residual weakness. This exploration of Guillain-Barré syndrome underscores the intricate balance within our bodies and how swiftly it can be disrupted. Stay tuned for more medical insights by subscribing and hitting the notification bell.